Hello friends, in this video we will talk about the topic hemodialysis. So the topic we are going to cover is definition of hemodialysis, then equipments used in hemodialysis, procedure of hemodialysis, indication of hemodialysis, and complications of hemodialysis. And at last we'll also cover the difference between the hemodialysis and peritoneal dialysis. So let's get started. And the first topic is definition of hemodialysis. So what's the definition? Definition is hemodialysis is a medical procedure. What's it? It's a medical procedure which is used to remove waste product and fluids from blood. It is done when the kidney is not functioning anymore. Okay, now the equipments used in hemodialysis are first a dialyzer. Okay, it's a dialyzer. It is also called as artificial kidney. It's dialyzer, also known as artificial kidney. Now here in dialyzer, dialysate is present. What's dialysate? It's solution. Okay, we cover dialyzer and dialysate. Then here patient would be lying. One channel would be going from the patient blood to the dialyzer, and finally the last one goes from the dialyzer machine to patient. Okay, equipment. The two most common and most important equipment is dialyzer and the dialysate. Now what is the procedure, or we can also what is the basic principle and procedure? So in the principle is, in hemodialysis the blood is removed from the body. The blood is removed from the body. Then blood goes to dialyzer. Okay, then in dialyzer there are semi-permeable membranes are present. Semi-permeable membrane. This membrane filters out the extra waste in the body, and then finally it returns clean blood to the body. Okay, this is the principle. Now what are the indications of hemodialysis? Hemodialysis is used in basically acute kidney injury or CKD, that is chronic kidney disease. So further indications we have to memorize it as acute kidney injury. Here I can give you a mnemonic. So the mnemonic is SEVU. Okay, what is SEVU? SEVU is severe acidosis. E for electrolyte imbalance. And the most important electrolyte imbalance is potassium. When potassium is increased, then volume overload. Volume overload is in conditions like toxicity or in excessive blood transfusion. We can do hemolysis. Finally, uremic symptoms. Uremic symptoms, these are uremic encephalopathy, uremic pericarditis. Okay, now chronic kidney disease. In chronic kidney disease, we have to memorize that the hemodialysis is used in stage 5. What is stage 5? When GFR is less than 15 ml per minute. Okay, it's less than 15 ml. Okay, now the next topic is complications. What are the complications? Complications of hemodialysis we have to memorize. The complications we have सबसे पहले we have to do 2 classifications. One is long term or late complications, and one is early complications. What are the early complications? 3 complications. Hypotension, most common complication. Then cramps, and then DDS. What is DDS? It's dialysis disequilibrium syndrome. Okay, and the long-term complications are amyloidosis or anemia. Okay, now the last one is how to differentiate between hemodialysis and peritoneal dialysis. See, hemodialysis and peritoneal dialysis. Basically, one thing is that hemodialysis is more commonly done than peritoneal dialysis. In tertiary care center, in hospital, hemodialysis is used more commonly, or we can say that it is the most common one which is used. And peritoneal dialysis, it is mostly done in home. Okay, this is the last option to be done. Okay, fine. Now the difference between hemodialysis and peritoneal dialysis. So hemodialysis is done in, as I told you, that tertiary care centers or hospital. Very rarely it is done in home, but peritoneal dialysis is done in mostly home. As it is done in center, it can't be done daily, so it is done thrice or twice a week. Like the blood should be cleared every 2 to 3 days. Then it is done daily. We can say that in end stage disease it is done twice daily or thrice daily. How hemodialysis is done? It is done by vascular access. And peritoneal dialysis is done by peritoneal catheter. Now vascular access. We have to a little bit. I will tell you about vascular access done. First, it is AV fistula. Okay. Second is AV graft, and finally central vein catheter. Okay. And it is done by peritoneal dialysis is done by peritoneal catheter. Now, the last one is the invasiveness. It is more invasive. Like both of them are invasive, but it is more invasive. And finally, it is less independent. It is more independent. So that's all. And the most important take home message is it is used in AKI and CKD. CKD is an end stage renal disease. Okay, thank you.